I'm so excited to talk to Evelyn Scott today. Evelyn, welcome to She Can. Thank you for joining me. Thank you for being here today. You are a writer and women's health advocate. You're an endometriosis advocate and disability speaker. You've been seen on Channel 5, The Times, The Daily Mail, Metro, Tortoise News, etc. And all of this came because for 15 years you've been dismissed by doctors, having your symptoms ignored, and received, in the end, a diagnosis of severe endometriosis. Since then, you
Yeah.
made it your mission to help other girls and women in the same position. Evelyn, so tell us a bit more about your journey and how you feel you got to where you are today.
So firstly, thank you for having me. It's an absolute pleasure to be here. My name is Evelyn. I have very severe endometriosis. I'm actually just 3 months out of having a hysterectomy, so I'm still recovering. How did I get to where I am? I think it was a rant that got out of control. I got very fed up of being told that periods were supposed to be painful, that to be a woman is to be uncomfortable, that you just need to suck it up and tough it out, which is, I really believed, I really bought into that narrative. And when I was a young girl, I had my first period when I was 13, and I didn't learn much about periods at school. I learned from my peers, and I watched my friends having very different periods to me. And I knew something wasn't right, but then I was told by medical practitioners that actually that's normal when actually it wasn't normal. So I suffered from pretty debilitating symptoms for about 15 years and then had endometriosis bowel obstruction, which was the straw that broke the camel's back, really. I was
Mm.
so fed up, and I remember sitting in a hospital waiting room. I'd been in there for about 8 hours. I was crying, and I just opened social media and just let it all out and realized that actually there are so many women in the same position as me. And I was so angry because we were all sort of stuck in this medical odyssey of being in waiting rooms, being sent home with painkillers, and yet being told that there was nothing wrong with us. So I started to create my own network, and it kind of boomed from there, really. I started talking to the press, and then I decided to write a book about it. And yeah.
Evelyn, and you have been living this
Mm.
fact that women suffer in silence, and it starts when we turn into women. It starts with our
Yes.
periods. It goes right through all the reproductive cycle, whether that's fertility issues, losing babies, menopause. The whole cycle of a woman is sort of there are conversations now because of very brave and courageous people like yourself who stand up
Thank
and
you.
tell their stories. And then you realized how many other people are in the exact same position. So tell us a little bit more about this fact, that you had to suffer in silence for so long, and the learnings that you take away and turn into your advocacy work.
Yeah, so I think for me, I was always aware that there was a substantial lack of research into women's health. And
Mm.
because of that, women's health condition, whether it be menopause and fertility, tends to be brushed under the carpet. And we don't want to talk about it. As a society, it makes us very uncomfortable. And that's something we have to get out of, because the more people that talk about it, the more normalized it becomes.
Yeah.
And I think it's so deeply ingrained that we don't talk about it, that a lot of women as well are uncomfortable to talk about it and they feel
Mhm.
like they can't. So by having these conversations and by being really open on my social media and with the book next year, I'm hoping to encourage women to come out and to speak their truth and feel that they can have these conversations with partners, with workplaces, and with their doctors as well. Because at the end of the day, it's a collaborative, effort. Things are only going to change if we all work together to make these things change. So that's what I've learned massively from my journey, and I really want other women to feel like they can talk about these things, because suffering from conditions like endometriosis is incredibly lonely. You're stuck in this cycle of chronic pain. You go to the hospital a lot, you're told your tests are normal, so you're sent home with lots of painkillers, you're stuck on waiting lists, you doubt yourself, you question your own sanity because a lot of people say, oh, she's being hysterical, pain's all in your head. So you start to think, oh, maybe the pain is in my head. And, it's really frustrating and isolating. And I'm so glad that people are now talking about it because for a long time people didn't. And that makes the world a bit of a scary place when you're in pain all the time. You don't know where to turn. And conditions, I mean, gynecological conditions can be incredibly disabling. I think people view it as, just a few period problems, but conditions like this and adenomyosis and PCOS can limit your mobility, it can limit your bowel function, it can result in chronic fatigue. It has a huge effect on the body, and people don't really realize that.
Yeah. Evelyn, so talk to us a bit more about endometriosis. What are the symptoms? What is it like living with it? What are the different possible treatments?
So endometriosis, the medical definition is endometrial-like tissue growing outside of the uterus, and it can attach itself to any organ, bowel, bladder, lungs. It's an all-body systemic disease, and there is research now to show that it has a big link with your immune system. And the first line of treatment is often a contraceptive pill, which seems to be the umbrella treatment for any woman's condition. You need to go on hormones, that will sort you out. Which isn't necessarily true. It works for a lot of women, but then it doesn't work for others. And we're still learning about endometriosis as a disease and why different things work for different people. The only way to truly diagnose it is by having laparoscopic surgery, which I've had several of. And unfortunately, people are very reluctant to operate on women and do this diagnostic exploration of bodies. Took me a long time to convince them to open me up, and it's an incredibly invasive procedure, and there are a lot of these surgeries that actually miss endometriosis because unless you're being operated on by a specialist, a lot of people don't know what to look out for, and there's a lot of misinformation around that your endometriosis will show up on an internal ultrasound. That absolutely isn't the case. I was told that my ultrasound was clear and I couldn't possibly have endometriosis, which I now know was rubbish. And that's because there's a lack of specialists out there because we just don't know enough. And the end of the line treatment is often considered the hysterectomy, which is what I've had, but even that isn't a definitive cure. And before I had the hysterectomy, I was trying different coils out, different forms of hormone. There's a lot of synthetic hormones in pills, in the contraceptive pill, which can actually play havoc with women who have endometriosis because it makes the tissue very sticky, which is not what you want when it's attaching itself to other organs, and it often results in organs being fused together. And that was certainly the case for me. My bowel was fused with my ovary, and my ovary completely died, so it had to be removed anyway. And it presents in many symptoms. So the obvious one is very painful periods, but the sort of period that would make you fall over, bend over, curl up into a fetal position, cry, be sick, horrendously painful periods, and that pain really takes your breath away. You also get spasming cramps in your groin. It affects you have pelvic pain issues as well, so you can't always move around. Bleeding can be incredibly heavy, and we're talking massive clots as well, really uncomfortable, bleeding through several pads at a time. Get backache, you get very intense headaches. But the interesting thing about endo is that it presents differently in different people, and there's no real understanding why some people can have very severe endometriosis and very few symptoms, but also can be the other way around. You can have incredibly severe symptoms and actually only have a little bit of endo in there. We don't know enough about it as a disease. I mean, people are really talking about it at the moment, and I know the well-being of women are doing a lot of research into it, but it's still so unknown.
Evelyn, I'm so grateful for you to be so vulnerable and brave on talking about those, topics that really even in 2025, is still not a norm. And I'm so grateful because, I have 3 children, 2 boys, 1 girl, and I'm so grateful she can listen to this because it normalizes this, all of these possible symptoms. So what top tips would you give a girl who is listening or read something and thinks I'm experiencing those symptoms? What are the first steps to do?
First steps would be talking to your doctor. If you have a family doctor, GP, go to them, talk to them about your symptoms, and ask to be referred to gynecology. That is often the first step. If you can and you suspect it's endometriosis, try and get access to an endometriosis specialist because they are the ones who are going to know. I mean, I saw a lot of doctors over many years who had no idea, and I happened to be in accident and emergency one night, and incredibly, there was an endometriosis specialist on call
Mm.
who took one look at me and was like, "You have endo?" And I was like, "Where have you been my entire life?" So it really is all about trying to get access to the specialist. And there's a lot of good information online as well. I found during my journey that joining Facebook communities and looking on Instagram and TikTok, obviously be very careful. There's a lot of false information out there, but also there are a lot of women in the same position, and a lot of these women are very willing to talk to you and discuss symptoms because we all want to help each other and we want to make sure that this doesn't happen to anyone else. But the key is to get in front of those specialists, and even if your tests do come back normal, you know your body, your experience of your body is real, and don't let anyone take that away from you. You know you are an expert in your own body. So when tests come back normal, you need to take a stand and say, there's something going on and I want to know what it is. And basic healthcare is a fundamental human right. We should all have access to it. So get in front of those specialists. If you can, reach out to them as well on other means, email them. I did that a lot. I think I drove mine mad. But yeah, right, reach out to the right people, gather that sense of community which you can get online, and also think about other things like nutrition. Nutrition has been found now to have a massive impact on endometriosis symptoms. I've actually cut out gluten because one of my big symptoms was actually had a very bad bowel problem. So I was very uncomfortable when I went to the toilet all the time, and cutting out gluten actually really helped me deal with that. And I still don't eat gluten today. And also seeing physiotherapists. There are some great pelvic pain physiotherapists out there that a lot of people aren't even aware exist, but they're brilliant and they focus on conditions like this. So just sort of fill your toolkit with lots of things. So you've got lots of things. Hot water bottles as well are incredible, but obviously, yeah, not going to fix it.
No.
As much as I
Yeah.
love mine.
Yeah, I feel like that's really something my grandmother taught me. I use it for absolutely everything, whether that's a
Yeah,
muscle spasm or anything. But
absolutely.
um, Evelyn, so tell us a little bit about the challenges you are still facing. You are still facing this even though you had a hysterectomy. How do you live with it? What does life look like? And how do you stay positive and optimistic and live life?
It took me a long time to get to the positive point because I used to feel very guilty about not being able to function. So when I was in my teens and my early 20s, I was a very active person. I used to do a lot of horse riding. I used to go to the gym a lot. I used to go clubbing and raving and had the time of my life. And when my endometriosis deteriorated to the point where I often couldn't get out of bed in the morning, if I did things like go for walks, I would be crippled for days. It was really hard for me to come to terms with that. And I used to feel guilty because I'd let people down all the time. I'd commit to things that, realistically, I was never going to be able to do. So that was really hard for me. But I think I kind of I found peace with rest. I decided, you know what, I need to listen to my body, and my body is telling me something. But life is still very hard. I mean, I have to factor in what I'm doing so that I don't feel too tired. So I burn out a lot. So if I have lots of social arrangements, I need to schedule time to recover from that and rest. and try not to feel guilty about having that rest, because the fatigue is very, very real thing. And also being in pain all the time is exhausting. Life at the moment is, I feel, getting better. I feel like the hysterectomy has made me much more comfortable, but I have started to get niggles again. And I've just thought, well, I need to just sort of rest again, just recuperate, give myself time, look after myself. I think that's the key. But, I don't have intimate relationships anymore, sadly, because sex really hurts me. And that took me a while to come to terms with as well. But actually, I've got animals, I've got lots of animals, so they kind of give me the love that I feel I'm not getting elsewhere. But no, life, it's day by day. I think with these conditions, you have to manage it and see how you feel on the day. And if you feel, you'll often know if you're going to have a bad day, and then just listen. If you have to go and sit on the sofa and watch Netflix from under a duvet, do that. Don't fight it, because the longer you fight it, the more you will pay for it later. And other days will be good. You'll be able to go out and do things, but other days will be bad. And it's very unpredictable, which I think is one of the hardest things, because you can't really have a life around it. I found working was incredibly hard. I ended up quitting my job. I used to be in academia, and I just couldn't work around my pain, and I was having to go home all the time. And it's very difficult for people to be accessible, to give you accessibility when they don't really understand the disease itself. So I found that actually I was killing myself trying to work, and it just wasn't working. So I decided to stop working, and that was how the book came about, actually, because I thought, you know what, I'm going to do something, because my brain's still going, but my body's just not behaving itself. But it was the best decision I made, because I think when you have these conditions, you push and push and push yourself, and you try and fit in boxes that may have worked before, they don't work now. And it's a case of listening to your body and figuring out what works for you.
Evelyn, as I listen to you, I'm wondering, how do you want people to talk to you about this? And I always think this is an interesting question about anyone who lives with an enormous amount of loss, actually, right? There must be a lot of grief around all the things that you can't do. And you come across as someone who actually looks for all the things that she can do. So you have definitely
Taken a while.
yeah, turned this pain into purpose, which is what you're doing by writing the book, by speaking out, by going on the podcast, by writing the articles, etc. But tell us a bit more about, how do you want people to address this, which is often an elephant in the room, isn't it?
I want people to just come out and say it. I'm one of those people that just say it, just come out with it. Don't pussyfoot around. Don't worry about offending me, because I love it now when people talk to me about it. And I feel like I can say, I'm having a flare up, and people understand more, the people around me understand what that means. But I think we need to talk about it and talk about periods, and not be worried about offending me. I mean, people often start the conversation with me, or how's the endo going? Sorry, you don't have to answer that. It's really okay. If it's too much information, don't. And I'm thinking, you're more embarrassed about it than I am.
I
So
think that's
I just
often
think,
the case, yeah.
yeah, and I think actually we need to talk about it. We need to just be open about it and be casual about it, because it's as common as diabetes,
Mm.
and every woman has a period and has been having periods since time began. So I find it quite bemusing that we still feel like we cannot talk about it at all. It's the elephant in the room. But I love it when guys talk about it. That's my favorite thing. So I live with my brother, and he was talking to someone at his workplace about it. And he often does, he chats about it, because he's helped me, he's been my carer for a while. And one of his colleagues' girlfriends was having very bad periods, and had said to him, oh, my girlfriend's in a lot of pain, she's being investigated. And they're bricklayers. And my brother turned around to him and said, oh, is it endometriosis? And this guy dropped all his bricks on his foot, because he was like, what? And I was like, this is the conversations we need to be having. Like, let's get guys talking about it as well, because
Yeah.
men will know, you'll know somebody, whether it's your sister, your girlfriend, your mum, like everybody will know someone with endometriosis. So feeling like it's the elephant in the room is a bit nonsensical, really.
It is, yeah. Evelyn, so what do you feel are you most proud of, to date? Sort of if you think about this journey that you have and are living.
So I'm proud of the network I've created. I've created a great network of women who all talk to each other. We all confide in each other. We open up. We reach out when things are tough. And I'm proud of all of those women for agreeing to be part of this and being vulnerable and, and sharing their stories. Because for the book, I have a lot of case studies. And I spoke to so many women, and they are so brave and so incredible. And I don't think they realize how brave and incredible they are. When you talk to women who are mothers of 4 or 5 children, and yet they're battling these conditions. And I'm just like, if you took a step back and looked at yourself as a stranger, you would see how incredible you are. You're an absolute warrior. So I'm really proud of those women, and I'm proud of myself for writing the book when I was recovering from a hysterectomy.
Yeah, I can
That
imagine.
felt like a bit of a mission.
Yeah, it must have. Evelyn, so give us a little bit your view of how our administrations, our governments, how do they need to reframe these conditions that, we can live with? What are the sort of 3 top things? If you had a direct line to our Prime Minister Keir Starmer, what would you tell him?
So I would suggest creating a national action plan for endometriosis. Australia have done it, France did it as well. And I think that's the only way that we are going to see the sort of change that we need, because I think it's very easy to blame the doctors, but actually the doctors aren't given the research that they need. They're told that, you have 10 minutes to see a patient. And how on earth do you define a lifetime of pain within 10 minutes? They need
Mhm.
longer appointments so that they can actually have a relationship and gain some real understanding of what's going on in their patients' lives. And I think that would all be addressed in a real comprehensive action plan. I also think we need to fund women's health. I know it sounds so simple, but we have people who decide who get funding. It's often made up of panels of men, and there aren't many women on them. And they tend to want to invest in conditions that affect both genders, and these conditions are very important, but so are women's health. So there needs to be more diverse funding panels, and I think for a condition that is as common as diabetes, and yet we have a lot of money going into diabetes. We need to have that sort of money going into conditions like endometriosis, because what's becoming more obvious now is that there are so many women who are suffering. And as the conversation keeps going on, we're all crying out for things to change, but nothing is actually happening at the government level, which is where it needs to start. I did speak to a few MPs about this, and they said, they've been trying to sort of bring up the conversation, and yet there are still MPs that walk out the room because they don't feel comfortable discussing anything period related, and we need to
Absolutely.
get over that because it's ridiculous.
Yes. Yes. And so what plans or goals? Do you have plans or goals? I know you live by the day. You take the day as it comes. You are really concentrating on your well-being. What do you have a sort of concept of goals or plans
To
that
go on holiday. I haven't been on holiday for a while.
good
I'm often
plan?
worried. Yeah, I really want to. It's been quite a few years, and I've always been scared to, because I worry that I'm going to have a hideous flare up and I'm not going to have access to the healthcare that I need.
Mm.
So that's been a real fear. So I'd love to get to the point where I can go away. I might start local though, I think, just to get over that anxiety. I'd also like to do more things like this, talk to more women, get this out there, get people talking about it, keep the ball rolling. I have a couple of horses as well. So one of the things that I love doing is being able to go and ride my horse, which has been a real struggle the last few years. And luckily they're very well behaved and they kind of understand that I'm not very well. So they do look after me. But it would be nice to go out and just do that, just have a nice ride in the woods and not have to worry about things like that. So yeah, and maybe another book. I'd love to write another book.
Well, now you're going to get this out into the world. That's an
Yes.
amazing achievement, Evelyn.
Thank
What
you.
would you like our listeners to take away from your story?
I think for me, I want people to talk more about periods. I want them to feel comfortable talking about their bodies as well. I think women's bodies are absolutely incredible. We do amazing things, and I really want people to acknowledge that and feel like they can talk about that to people, and not just, I'm not talking about news outlets and doctors. I'm also talking within a sense of community, talking to friends, talking to family, because I think that is, again, a real good place to start change, to be more open in conversations. And I think it's important that we involve younger girls in this conversation as well, because I think the earlier we can get diagnosis in and the right treatment, the better their quality of life is going to be. So we need to start talking to children about it. And I know a lot of my friends are now talking to their daughters and saying, how is your period? Is there anything you're concerned about? And that will, I think, will save lives.
Evelyn, I'm so happy to have you on She Can.
Thank
Thank you
you.
so much for all of your insight and your lived experiences, and for talking so openly about your struggles. And I'm excited because I feel there is a national support circle on the horizon. There's
Yes.
such power in numbers, and I always think
Yes.
those things are always started by an individual. So I'm sort of excited
Thank
about all
you.
the things you're still going to do with it, and a national action plan, and really
Absolutely.
pushing for, you lead with your story so beautifully and so
Thank
powerfully, and
you.
you make a real impact by pushing those agendas forward.
Hmm.
And if it's not you, then who? And I really strongly believe that. So thank you so much for
Thank you for
talking to
having
me
me. It's
today
been
and
a
for being
pleasure.
on